a few people joined. For the folks that just joined, I asked some folks to test our interactive interface. I have some polls and some Q&A. So when you have questions, you can click on Q&A and ask a question. Also, just to test it, please just say where you're from. I'm here in Austin, Texas. Bill is in DC and John is in Minnesota. And we'll get started soon. So as you put in your destinations, I'm going to start just a quick poll to test the polling interface as well. Looks like we have John from Orange County visiting. So here's an easy poll. How you guys feeling today? And you can rate with stars.
Apparently I can't participate.
All right, call it out and I'll add it to the ratings just in my head.
5-star.
5 stars. How about you, Bill?
I'm a 5-star guy today too.
5 stars. All right. Can you guys see the results here?
We can.
Looks like everybody's feeling pretty good, which is great. Hopefully we will maintain that feeling today through. All right. So quick introductions. Hi, my name is Arcinue. I'm an executive at Zoho Corporation. We're a software SaaS firm that provides basically all the software you need to run a business. We're known for our customer relationship management system, but we also have the software to run your financials, human resources, analytics, your office and collaboration suite, as well as the CRM and customer experience suites. With us today, we are joined to talk about the thought leadership with regard to technology and process. And we're joined by John Fraser from Recover Health. Welcome, John. And Bill Dombi, the president of the National Association for Home Care and Hospice. Welcome, Bill.
Thank you.
You know, I got a chance to introduce myself. I've been in technology for quite some time, having had experience at Microsoft and Hewlett Packard, and had some experience in entertainment with Creative Artists Agency, and then recently at LegalZoom as a chief customer officer, and now at Zoho helping them build a presence in the enterprise space. We've got 50 million customers, worldwide, with 40% of the US, but our growing segment are customers like John, who are larger companies that are utilizing our software that has kind of the ease and friendliness that you'd expect from a small business software suite, but we've built in a lot of the security and infrastructure and resiliency that's important to companies like that. So that's my pitch on Zoho, and I'll stop there. And my relationship to healthcare, because this is a healthcare thought leadership, is my parents were doctors. I should have been a doctor, but I fell into technology. But have a close love and appreciation for all things healthcare. And for those of you in the healthcare space, I just want to extend my thanks, and also from the whole family at Zoho for being on the front line of this current pandemic and for tackling this. So I'm going to pause there and allow John to introduce himself and tell us a little bit about Recover Health, and Bill as well with the National Association.
Perfect. Good morning or afternoon, depending on the time zone you're in. John Fraser, CIO for Recover Health. I've been with Recover Health for about 2 years, but fell in love with healthcare way back in 2011. I've always been on the post-acute care side of healthcare. Prior to that, had a stint as an entrepreneur, spent some time focused in manufacturing, financial services, and I found a lot of synergies between the different industries in terms of sort of modernizing from paper, the consolidation of different providers into larger organizations. And really fell in love here with Recover Health. As kind of Ed mentioned, we're a mid-sized company on the grow. The real small kind of niche software platforms aren't really a good fit for us yet. We're not ready quite yet to purchase the really big, huge, monster, expensive platforms. And so I'm happy to be here today to give you some insights into what we're using technology for to make it through 2020 and how we're using it to be a differentiator and actually thrive in 2021.
And
Thank you.
I'm Bill Dombi. I am as Ed indicated, the president of the National Association for Home Care and Hospice. The acronym is NAC. We actually began in the early 80s, and one of the first actions of our board of directors was to determine how you pronounce the acronym. Is it going to be NAC or NOC? And the board said they want knock knock jokes, so we've stuck with NAC, although most people still call us NOC. Nonetheless, we're a very typical trade association. We are the largest association in the country that represents the interest of home care and hospice providers, and it's home care and hospice providers of all types. The Medicare home health agencies and hospices, as well as the non-medical personal care services providers. For those of you who don't know home care, just a brief little demographic on it. We serve about 12 million patients a year. They come from all age groups, pediatric, ventilator-dependent children who may have been prematurely born, all the way to end of life for people who've lived on this earth for 8, 9, 10 decades or more, and everything in between. Much of the service is a hands-on, high-touch service from nurses, therapists, home care aides, but it is also very much a high-tech service as well. Really extended use of telehealth care, extended use of operational technologies as well, everything from point-of-care planning through electronic medical records, and then, as I mentioned, with telehealth on the clinical services side as well. Unlike John, I'm not new to this space. I actually have been working in the world of home care and hospice since the mid-'70s. And it is a passion-driven kind of work that we get to do, and most people involved in home care are very passionate, and I'm sure John has, in his 2 years' time so far, has probably taken a little bit of that on, if not a lot of it already, so he's probably hooked for the rest of his life. The home care community itself as a provider group is very wide and very deep. The patient population I mentioned is one thing, but the provider population is an entirely different thing. We have small mom and pop operations, in the hills of West Virginia, and we have public companies that are multi-billion-dollar operations. The number of workers in care in the home right now is about 3.6 million people. There are all types of payers for home care services, Medicare, Medicaid, the VA, TRICARE, commercial insurance. It's subject to fee-for-service as well as managed care operations at the same time. But we have private pay, which is significant in terms of purchasing, particularly personal care services. All told, and this is the best I could offer you, is an estimate of what this universe looks like. It's about $120 billion a year operation. Most people really don't recognize that. They see it as something that takes care of their grandmother. But this is a highly sophisticated, incredibly experienced delivery system of healthcare. And as we'll talk today, very much on the forefront of the future of healthcare. So thank you, Ed, for the opportunity to be here. People can do the math on how old I am. Yes, I am older than the rest of you, but I think I'm younger at heart, perhaps.
I agree with that. You definitely have that energy that I appreciate. And then talking about, that intersection of complexity, expertise, and technology. John, you're on the front line of that. What does that feel like from a challenge standpoint for you?
Well, I think Bill mentioned a lot of different services in the post-acute kind of home care hospice world, and Recover Health actually has services across a lot of that. So when you talk about the complexity of the market, it does create challenges for organizations that are trying to grow. They have to have software solutions, they have to have processes set up to handle these different areas, and you might expect that if you're taking care of a pediatric client that they have different needs than when you're doing intermittent service with somebody that's just coming out of the hospital and then leaving your care 60 days later. That creates a tremendous amount of complexity in terms of how you handle your sales, how you handle your recruiting, how you operate your business. And so that's a really big challenge for small organizations and big organizations alike, just because you have to make these decisions around technology. And there's kind of two ways you can go with that. Some organizations try to go the idea of having one piece of software that does everything. My philosophy on that is that if you try to do that, it does everything mediocre. It doesn't necessarily handle things well. On the flip side, if you select individual pieces of software for each of these areas of your business, you have your finance platform, you have your HR platform, you have your operational platform, you have your recruiting platform, you could run into the challenge that if they don't synchronize, then it's going to be really, really difficult to ever scale and have interoperability between that. So I'd say the biggest challenge is finding that right mix, but no matter where you go to find these software products, whether there's or not that allow that interoperability and that data exchange so that you can run your business efficiently if you're a service company powered by technology.
Can you describe your stack to us for the audience? Like, what does your technology envelope look like?
Yeah, absolutely. So as most healthcare organizations, we have a number of different EMR solutions. We use point-click care to handle a lot of our commercial or third-party payers. Then we actually have a private pay platform, ClearCare, from WellSky that we use on the private pay side. And we use different software to sort of connect the dots there. So getting back to that interoperability piece, we leverage Zoho analytics in this particular case to get a nice 360 view of our operations as it relates to the electronic medical records platforms. So somebody can actually find service in both, and we have full insight into that by using our business intelligence and different dashboards and tools to be able to bridge that gap there. Coming in 2 years ago, we've implemented a number of new products, and the organization was already on a technology vision before my time and really have just helped accelerate that. Prior to my time, they put in an HRIS system using Paylocity. They put in a learning management system using Relias. They have Sage Intact for our financial services platform using Zoho CRM. We're using Zoho Recruit. We have a number of different platforms back there, but I'd say those are probably the 5-6 largest platforms that we have across the organization. And then again, the critical component is that we have the ability to interchange data across all of those platforms.
I think that many organizations, not just healthcare, are in a similar boat of multiple platforms. Bill, when you look at like the technology landscape and you've seen it evolve over years, how have you seen these transformations occur? I mean, are they event-driven? Are they market-driven? I mean, you've been able, or both? I mean, we're going to get into the next point of this discussion, which is, event-driven acceleration of adoption because of necessity. But what have you seen in kind of like the eras of hospice and home care with regards to technology growth? I mean, was it always in your vision, through this association that technology was going to be a keystone for these organizations?
Short answer, yes. The awareness of that was not as great outside of the direct providers of care and those of us, who are supposed to help, be the thought leadership. I recall a conversation with a member of Congress, now retired, where she's technology. There's technology in care in the home. And, we've been, working with EMR, for example, well before it was finding its place in the rest parts of healthcare services, technology from a clinical perspective as well. And to really give an understanding of it, I'm going to try to give you a three-dimensional picture of what our exhibit hall looked like at our annual conferences, where we had 4-story exhibits in 60 by 60 booths from the technology companies. They dominate our exhibit hall space. That reflects what we've got going on in the industry of home care. Technology, is used for communications back and forth between referral sources and physicians and care planning on the billing side of it, as I mentioned, on the clinical side of it, but also, a very heavy driven approach on an evidence-based practice approach that relies upon the technology to give them the data with analytics in order to make some very conscious choices on efficiency as well as quality outcomes. much of what goes on in home care is paid for by government sources, so the accountability is very, very, much in play, and technology is one of the reasons why they're able to achieve that kind of accountability. But I have to hope that my constituency is more adept at technology than I am. I grew up thinking that I didn't need to know how to type because I was going to become a lawyer. So I am still a two-fingered hunt and peck typist when it comes to keyboards at this point. So we keep hoping for more advances in technology on voice recognition, but we do so. But at every facet of operation of home care and hospice, whether it's the personal care private pay side, or the Medicare home health side or hospice services, technology is crucial in everything that's done. And this has been the insight that we believe care in the home has had for a long period of time, and others are catching up with us right now as compared to we catching up with them. But as John said, one of the most difficult parts of it is interoperability. And when you've got Medicare requiring one thing and Medicaid another thing, and one physician with one platform and another physician with another one, and referral sources, it's chaos. And anything that you could do to try to connect some dots on there, because the other driver, particularly since it's government paid for services in so much, is you've got to be very efficient, because you're managing to the penny. And any wasted time on paperwork, be it electronic or, real paper kind of thing, is a major problem. And as soon as any home health agency or hospice has a profit, you start seeing somebody in Washington saying, we got to take that away. So you keep getting pushed more and more towards those efficiencies. And we saw that, in two ways then, more than a couple of decades ago, was that it would help us continue to make the case for the value of care in the home being the most cost-effective approach, at the same time creating a clinical linkage throughout the healthcare system, which we are actually now seeing blossoming across the country in COVID-19, where you can do pretty much everything at home because of that technology. We think that we've been building towards this for quite a while. So we actually have smiles on our face at this point.
I think healthcare and technology and these challenges have been there, and will continue to be there even before COVID. Let's talk about COVID, because 10 months ago, and maybe even a little bit before that, it started to really impact the healthcare industry. Walk me through, maybe, John, how your organization responded to it. I'm going to start a poll regarding this for the audience. How did your organization respond to COVID? If you think about between March and today, were they proactive, reactive, transformational? I see one transformational vote.
I guess, do you want me to talk while we're doing the poll?
Yeah, let's wait for this poll to finish out. Looks like some reactively. Looks like everybody responded at least not well, or no one's going to admit that. But that's great. I think what we've seen is there's things that you had to do. There's things that, as those new factors and evolving news happen, you had to take a proactive approach. You couldn't just be reactive. I'm glad to see that some folks have seen this as a transformational environment. And I know, John, you have as well. And I'm sure, Bill, when you're just talking about how this showed up for your organization, you've probably seen all three of those, or four of those results across the organization you do. Let's go to John and just walk me from March till now. What have you had to do starting then? Where are you today? How did your priorities evolve over time? And then, Bill, maybe you could give us perspective of how you've seen organizations react reactively, proactively, transformationally to this as well across the industry. But John, how did Recover Health respond to this? What were the first things that you had to do? What happened during the process? Where are you today?
Yeah, I'll go just a little bit further back from that, because it's important to understand that one of the things that I was attracted to about Recover Health was that they knew that they wanted to transform their technology and make it a differentiator for them. And so they were already in the mindset of, we need to invest in technology to improve the conditions for our employees, improve the conditions for our clients, our referral sources, across the board. It's still a services company powered by technology. So with that mindset of our organization, active census at any given time of over 4,000, 31 branches, 6 states right now. You might imagine that COVID had a really big impact on that. And the impact for us was that it really accelerated, transformed the organization. These were items that we had on the roadmap that we knew we wanted to accomplish for the benefits of all the people I already mentioned in 12 months, 24 months. And what COVID forced us to do in a positive way, with all the negative that occurred with it, is it really forced us to ramp up our resourcing to find out how do we do it in 2 weeks, 2 months, 3 months, 5 months. And that's exactly what Recover Health invested in and allowed us to do. And as a result, we're seeing record number of admissions every week. We're seeing length of stay increase. We're seeing a lot of positive trends that we're helping the communities more, especially the rural communities where we're serving. And as you might imagine, things change drastically for us as we have been growing from that mid-sized company to a larger organization. We used to have a lot of our leaders spending a lot of what I call windshield time, traveling between different sites, doing the on-site audits, doing the on-site presence. It was only 6 months prior to COVID that we really went in and adopted Microsoft Teams and audio video technology. So pre-COVID, we were already familiar with it and we're using it to reduce the amount of travel time and frankly just wasted energy spending time looking at the windshield where you could instead be collaborating remotely. So I think, the high level is that COVID really accelerated things for us, but it meant bringing in solutions that were off the shelf and being able to customize and sort of have that interoperability, because we weren't going to be able to design something from scratch, or we weren't going to be able to take 6 months or a year to find the right product and move forward. We had to move very fast on many of these items, from being able to handle tickets for support requests. They're not just coming in from 31 branches now, they're coming from 1,500 employees' homes. They're coming from people that are in the field. We have to find ways to connect to somebody's computer now when they're on a dial-up connection at home or a satellite internet connection. How do we solve some of those issues? But it was really, really exciting for me to be part of an organization that was willing to invest, and frankly, it's ended up being for the betterment of our clients, employees, and everybody else as well.
Yeah, it's amazing when you're able to take an event like this and use it to accelerate your ability to care, your ability to deliver service, and your ability to make a difference. Maybe just if you could share us anything specific, great if it's Zoho, great if it's something else, but what's something that was new that you implemented that gave you some surprise and delight that you're able to go fast with and deliver to that group from a technology perspective?
Well, one example is the Teams example, but that was more from corporate, or what we call home office, to our branches. But we found tremendous value in, we couldn't have nurses or clinicians in the field come into the office. So how do we engage with them? How do we still handle career development? How do we engage with them in a positive way? So leveraging audio conferencing using Microsoft Teams to allow us to still stay in touch with the clinicians in the field, even if they were just in the parking lot, because we didn't want them in the branch for risk of exposure, because having them continue to care for clients and their well-being was number one priority. That was transformational for us. We found that everybody won in a scenario where we could handle some conversations over video and audio like we're doing today. It's not the same as a phone call. You get to see the mannerisms. You get to see the guy talking with his hands. You get to see whether somebody's rolling back and sleeping or whether somebody's really engaged leaning in. It's a really big technology differentiator there. One technology that is Zoho related, I'll say, really helped us transform the organization during COVID was Zoho Analytics. So for those that aren't familiar, it's similar to a product like Tableau or Microsoft Power BI, business intelligence engine that allows you to connect it up to different sources. And what it meant for us is that we needed to find ways to manage the company remotely. And we needed to be able to manage productivity, and we needed to manage, whether or not within 15 seconds is this organization or this branch or this person on the right track or not. So we took a number of leaders from the organization, and we had standing meetings every week with our chief strategy officer, Janet Failer, and Guy Harris, our director of training services, to just sit in a room or sit on Teams like we're doing here, on audio video like we're doing here, to build out these dashboards. And it absolutely transformed the organization. After years and years of trying to work hard to get certain metrics to this point or to that point, what we ended up doing with Zoho Analytics or a BI tool like this is, rather than a branch spending 4 to 8 hours a week running reports, and then on top of that, they would have to actually act on those reports, is that we had that automated, or we had that done by one person where they would manually feed those reports into a system, and then everything was broken out and published for them. So instead, what we have is we have an intern essentially running reports every morning that populates everything that we need along with the automation. And that takes about a half hour for the entire organization, one person. Now that 4 to 8 hours can be reallocated in the branches. And now we can actually use that same time that they were doing just to run reports. Now it's being done working on those reports. Now it's being done making sure they have the appropriate PPE. Now it's being done, working on engaging with our clinicians that are out there in the field, and hopefully not burning out. It's those types of things that the branch leaders and others in the organization were able to spend their time on. And those are just two examples. I could go on, but really, really transformational for the organization, and absolutely where we needed to go in order to continue the scale trajectory that we're on.
Yeah, it's amazing when you think about how an event like this can really force technology innovation and advancement. One of the things, and I'm gonna ask Bill, it's one thing to get everybody working remotely. It's another thing to get them operating with the right data and the right efficiency and making the right decisions on a changing environment where all of your assumptions and regular course of year over year is drastically changed. So you have to have a lot of agility in terms of analyzing data and being able to know what to do based on what you can see. And you can't just walk over to someone and ask. And you can't have disparate systems that are telling you two or three different versions of the truth. When you look at the industry, Bill, how have other organizations responded? I think it's one thing to get everybody to work from home. How do you get them to work from home aligned and march directly to the crisis that we're in?
One of the interesting things about what John talked about was how the corporate staff became remote working, because home care generally is remote work anyway. The clinicians rarely come into the office. And so the adaptation had to be with those people who, in the ivory tower of the corporate offices, who really could never appreciate what it was like to be a remote worker and the need for the kind of connections. I want to kind of give you a little bit of COVID context, because everything that John said happened in the context of an explosion of the pandemic, rather than some, trickle growth within it. In a matter of just a few weeks, all of healthcare was turned inside and out, and that included care in the home. We did early surveys of our members at town hall meetings. We had a lot of connections with our members through so many different channels. And the common outcome from all that input was there was a massive reduction in patient referrals, a huge question mark about the future of the organizations financially because of reduced patient referrals, reduced demand for the level of service, and no matter who the payer was, that was happening because patients were afraid of having someone come in their home as much as they were afraid of going out into the community. Referral sources like hospitals with elective surgeries, joint replacements stopped. And that was a big part of what home health agencies in particular could do. Nursing homes saying to the hospice, we're not letting you in because we're concerned about all the fatalities that we're seeing. So you saw within the month of March and April, just a turn an inside out kind of thing. So trying to make a transformation within that, John, had to be incredibly difficult. But what you showed was what we've also were seeing across the board in home care was, since they weren't burdened by the bricks and mortar costs of a hospital and an empty bed and those kinds of things, they could see the opportunity that was here rather than the burden. They could then take these steps to bring about a whole new delivery system if necessary. As we found, a number of them were suddenly becoming hospitals at homes or nursing homes at home, taking patients who would have gone into a bed in a hospital and being diverted from the hospital directly to home care with some additional support. Now, it wasn't easy. PPE, John mentioned, supply chains disappeared. People in home care are incredibly resilient and incredibly creative. Some of them were cutting open empty 2-liter bottles of soda to create face shields because they couldn't access them anywhere else. They were going to tattoo parlors that were closed and hoping somebody lived in the back room and they could buy or borrow some masks from them because they couldn't get them, in their normal channels of supply. So we saw this kind of quick pivoting, a word that we've probably all used more times this year than we have ever had in our lifetime, to that, and looking for ways to make this all happen efficiently. Bring it forward to where we are now in December, and John's reflected, I think, what we've seen across the board in care in the home. Business is no longer down. It may be in excess of what it was pre-COVID at this stage because of the choice of receiving care at home has grown. Even if some of the patient population hasn't returned, a different population has returned. 70% of all home care companies are serving patients who are COVID-19 infected. So they had to clinically change on that. Their practices changed. They had to do all with the workforce issues too, because you weren't going to send every staff member to every home that was COVID-19 because you could then start spreading it further that way. They had to change their customer management practices to educate them about how infection control was such an important part of what goes on in home care. So that's where the demand started turning around all over the place. So when we look at home care, when you see the end of the year, statistics on home care in this COVID year, what you'll see is we were going up, until March, then we steeply declined, then we leveled off, in June, and then we started to increase back to pre-COVID levels. And now, while not everybody's back to pre-COVID levels in terms of patient volume or revenue or anything else, many of them are exceeding it. And, so it's not like that we're celebrating a pandemic, without a doubt. I mean, we got a lot of people. We've lost people in home care. But within all of that, there's no doubt, that pivoting happened through creativity, through the drive, and through the passion that John expressed going on, at his organization, that we saw mirrored all across the country. But we saw one other thing coming from it, and we could talk some more about this. We saw policy changes coming out of Washington that were embracing care in the home, helping it happen the way it has happened this way. And part of it, it was driven by what we could prove to be capabilities, value, and efficiencies.
It's interesting talking to a lot of businesses, not just in healthcare, but in manufacturing and in technology. Those that have been able to adapt and rapidly change they experienced that initial shock, but probably around the same time frame have started to see that climb in being able to adapt to the situation, to bring their business back or bring their services back and be in a better position to accelerate into the future, which brings me to the next topic. And we talked about this a little bit, when I spoke to other folks in manufacturing or retail or in technology, this is we were debating the future of what the new normal was with no clear sight of where this pandemic was going. And we just spoke a couple of days ago where we talked about, what's going on with the vaccines. So there may be light at the end of the tunnel. There has been development and advancements, but that's not necessarily, there's a clearer path to where this is going to end up, especially compared to a few months ago where we didn't know what the development results were going to be. Now there's a huge logistical and operational requirement that you're going to also have to now adapt to. So when you think about, moving to the vaccination versus, what we're dealing with the transformation before, work, it's another set of processes and adaptability begins. And what I would say is, a lot of the things that you've been doing have been preparing you, whether you like it or not, to get ready for this next thing, to think creatively and on the spot and operationally, but they're completely different sets of circumstances. I'm going to start another poll, and I'm going to show something really quickly. So I'm going to show really quickly a dashboard here. And let me know when you can see this here, the COVID-19 dashboard. Is that sharing? Am I sharing that with you guys?
Yep.
Looks like
We can see your calendar.
Oh, let's not show the calendar. Let's do this here. Let's share this.
John, he's not very busy compared to you and me, is he?
I know. I was going to mention that.
How about now?
I don't know. Is that your motorcycle?
Oh, that is. You can see my motorcycle, but not my desktop.
I can see everything. You might want to just make it full screen.
Okay, I'll do that. All right.
I don't know. I'd rather see the motorcycle myself. So.
Yeah, are you a rider yourself?
No, my son is, but I prefer 4 wheels and fast rather than 2 wheels and
yeah, I'll show that in a second, but I do want to show kind of where the world is right now. Here we're using Zoho Analytics. We're getting data from multiple from sources, and this gets updated all the time. And if we just look at North America over here, now we're at 14 million confirmed cases, 280,000 deaths, 5.6 million active cases, and 8.4 million recovered. So I think we just had a record number of deaths reported yesterday, 3,000 deaths reported yesterday. So I want to underscore really the importance of the work that you guys are doing, especially with the most vulnerable folks that you're caring for. And again, thank you for that. And really want to throw in as much support as we can from our perspective. We there's only little things that we can do as a technology company, but we try to make it easy and affordable. Some other things we've done for workplaces is give away free software or for given some months for that. We developed a remotely app. We developed a back to work app so you can start to track people getting back to work. So I just want to extend that for anyone that looks at different software providers. We have some free services that we're doing towards the end of the year. We'll probably do more just to help with these things. And that's, we just want to appreciate and do what we can to help with this effort. When I'm thinking about the healthcare professionals that are here and what you're faced with the vaccination, I'm just going to throw out a poll on what your organizational priorities are. These are pretty general, but just something to think about. Are you thinking about, some combination? Obviously, everybody's going to be thinking a combination of people, process, technology, and operations. But where's that top focus for the audience? Where are you thinking about the most? And it could be something other that we're not thinking about. And if there's something other, please just put it in questions. I'm not getting any questions. Oh, there we go. People. I think it's always about the people when it comes to healthcare, right? Operations as well. Evenly split. Process. It's funny, some technology as well. Obviously, it's some combination of all these things, but something has to take priority. When we look at the priorities for 2021, and we had a brief discussion about this the other day, talking about moving into the future. What are the things that you're starting to prepare for, John? I mean, you mentioned buying refrigerators, thinking about refrigerated trucks, just completely different things. Like organizationally, what are you thinking about for 2021? And you're already making some purchases and making some buying decisions around this.
Yeah, I would say, going back to the poll, I would say that's a trick question that you just asked, because
It was.
in the world of healthcare, I would argue that my entire job as a technologist or as a process expert is to put in those things for the betterment of the people, and whether that's your employees or clients. So I don't know how I would answer that. I guess I'd have to choose people. But everything that we're doing is really in response to creating, efficiencies, creating safety, creating opportunities for us to tackle those. But to answer the question more specifically, I'd say yes. I never thought I'd be in the market of, becoming a customer for a freezer manufacturer and try to understand what that looks like. I never thought that we would need to hire somebody in the organization that focuses on nothing but our PPE management and inventory levels, and really becoming an expert in where to procure these things, because you typically would just have one or two vendors and that was it. But now you have 80 vendors, and it's whoever's got it and whoever can get it to you soonest. Another piece that Recover Health has done is we've secured contracts to work on actually doing tests. Just in the month of November, we had more than 11,000 tests performed just in the state of Minnesota, testing. And so we see in 2021, we see that transition and that agility that us, and I'm sure a lot of other home care and hospice providers are on the front lines doing, and transitioning that to the vaccine. So any forward-thinking organization is going to have the ability to do that. And I think Bill mentioned it well. We don't have the burden of the real estate. We don't have the burden of the huge clinics and hospitals and some of that. We're already accustomed to being out in the communities and out in the homes. And so it sets us up well for that. But it also means that technology's got to be there behind you to support that. So how do we accelerate recruiting? Or how do we accelerate our sales team? If they're not going to be allowed in the assisted livings, or if they're not going to be allowed in the hospitals where the referral sources are, how do we leverage technology like Zoho campaigns or Marketing Hub to mass market to these people? How do we change our interview process from an in-person process to something where you'll use audio video technology as the standard rather than the exception? A year and a half ago, we would have only done a video interview if the person happened to be out of state or more than 2 hours away. Now, the exception is that they're coming into the office, perhaps as the final interview process, but we're hiring people right on the spot after video interviews. It's a complete transformation where technology and process play a big role, but at the end of the day, it's all about getting the right people into the organization, or creating those efficiencies or creating those processes so that you can deliver vaccines, you can continue to test. And I think Bill mentioned it before as well, but I don't think we're going to probably consume PPE the same level that we were a year ago ever again. I think there's obviously a peak where we're at right now, but I think there's a lot of permanent changes that will be occurring in our industry and other industries that have been made permanent from COVID. We didn't talk much about it today, but telehealth, telemonitoring over here to I guess it's my right, maybe it's your left on the cameras, I'm not really sure, but I have our telehealth technology where we're partnering with Philips to supplement our need to be in the home with remote monitoring. I'm actually wearing a bio sticker that is monitoring 12 different aspects of my body right now. Wow. To see if I can proactively determine if I might get sick. God forbid I get COVID, but if I do, I'm curious to see if this bio sticker had the early warning signs for me, or at least could give me the help a little sooner. These are the types of things.
Telehealth and the bio wearables are a whole different topic. I don't want to dive too deep in that because we would go on for another 2 hours there. I do want to talk to Bill, because we mentioned the vaccination process the other day, and it's interesting how that transformed John's work. But you have a lot of educational information that I want to share with the audience about what CDC priorities are, what they should be thinking about, how these things are affecting healthcare. What are the things that people need to be aware of with the changing dynamics coming from the CDC, Washington, and your different states, how those decisions are being made, and how how technologists are going to have to react to those decisions as they come forward. I think we just talked briefly about the order in which the recommendations of deployment for vaccination are. So maybe you can give us a little education about what you're seeing in the industry and what you're seeing from regulators and the pharmaceutical companies.
Yeah, I mean, this week the CDC's advisory group concluded that healthcare workers would be the top priority, and that gave it a 1A categorization. And they included the broad array of home care givers in that respect, from nurses, therapists, personal care assistants, and all the other disciplines. As I mentioned, there's 3.6 million of those workers that are known to be out there, and they're all over the place, which means it's going to be difficult to bring the vaccines to them. So the vaccines they're going to have to go to the vaccines. What we expect to see happen is that they will be going to central administration sites, probably hospitals or other healthcare centers. But there's still a lot of decision making to be done on the state level, because you're going to have to prioritize within that first level prioritization to begin with. And it's all anticipated that it's going to be those people who have direct contact with COVID-19 infected individuals. It's going to take several weeks for all of this to finally filter through all the way of healthcare generally, but in home care. There are many things that are going to need to be solved, and we hope technology's there to help out on it. John, I don't know how you're going to identify those workers to anybody with a certification that they are a frontline serving COVID-19 infected patient kind of thing. It's not like we have federal IDs that you could then show when you go into a place to have an administration. So there's going to be chaos, I think, that'll come about through all of that. And that's before we get to the more difficult question of how do you administer vaccines to 12 million people who are pretty much confined to their home due to some illness, injury, or multiple comorbidities. Because transporting those vaccines has a few issues to it. I don't know about you, but my really high quality refrigerator freezer can't bring anything down to minus 94, which is what one of the vaccines, the Pfizer vaccine, requires for storage capabilities. But then you have some useful shelf life once it's thawed out there. But it's very apparent. There was a survey done by one of our colleagues just overnight indicating how important it would be to the workers and to the patients receiving care in home that caregiver is vaccinated. And it is their number one concern, but it's not like 99% said, I won't let you in unless you have demonstrated to be vaccinated. I think there's a practical kind of aspect to what people are looking at on the vaccine side of it. But we really think that they made a good choice, of course, in putting home care people in that category of the essential healthcare worker, that should be getting the vaccine on the front line on an almost immediate basis of access. I think I did tell you that I confirmed that they didn't put lawyers last on the list. So those of us like myself that are lawyers have some hope of getting a vaccine before it's all gone.
Luckily, it wasn't a popular.
Excuse me?
It wasn't a popularity contest based on profession.
I think it was an oversight. That had they thought about it, they probably would have put us in the mix of last in line, perhaps that way. But it's been pretty apparent, to the home care community that infection control, whether it's PPE or vaccinations or awareness and understanding, will be with us, for the foreseeable future, probably changing the face of healthcare at large. But maybe I do some woodworking, so hopefully I'll be able to get another N95 mask next time I'm doing some cabinet building, because you can't get them at Home Depot anymore. Yeah. But very, very, very important. I wanted to follow up a little bit on what John was saying too, if you could indulge me, because what we're seeing is the priorities out there in this world that we have now, as we look forward: workforce. The demand being greater than the supply of the workforce. And so anything that can be done to attract and keep the workers is going to be a plus. He mentioned telehealth at Philips. He may not know that Philips came in heavy into telehealth and home care about 2 decades ago and then walked away because the business wasn't there. Now they're seeing the potential for it coming forward, so they're coming back out there. And the other thing that everybody in home care is starting to think about, and I think very sensibly, is these new opportunities. Yesterday, it was announced by the Centers for Medicare and Medicaid Service that they're expanding the hospital at home program, which is a clear opportunity for many parts of healthcare, but certainly for the home care part of it. They can't do it right without a home health agency, for example, to do it right. So the people who are looking at the opportunities are now asking the question, how do I become more integrated with the health system, more integrated with a hospital? How do I get the physicians to work with me closer? And technology is absolutely the channel of communication that they're going to be relying on for that.
I think you'd also mentioned before that even if you deploy some of these vaccines, depending on the vaccine that is deployed, it might protect from a clinical standpoint, but it might not protect from a spreading standpoint. Can you talk to us more about that?
Yeah, this is Dr. Bill Dombi, right? No, I mean, I've got a Juris Doctor, not an MD. Yeah, but what I've been reading indicates that the vaccines may protect an individual from acquiring the virus, but they don't stop them from possibly being a transmission vehicle. That they still could transmit the COVID-19 to other people, even if it's not affecting their own clinical condition. At least that's what I'm reading relative to the Pfizer and the Moderna vaccine. AstraZeneca has shown some signs that it could help prevent transmission as well. Obviously, we all can transmit it just from having it on our person. But this was something that I need to know some more about, because I was hoping with the vaccine I could actually get outside again, but maybe not.
Yeah, I think we're a little bits away from that, and luckily for the industry, that healthcare workers are in that 1A space, and I think that's appropriately so, because we need that front line there to take care of the people that unfortunately are not have not been able to get the vaccine or might not get it for a while. I do want to pause here because we're running towards the end of the hour and leave some time for Q&A. If you have a question, please submit your question in there. Please also feel free to ask anytime later. You can connect with me on LinkedIn or directly with Zoho as well. And we're going to publish this webinar so that it can be passed on to your peers. I know that sometimes it's inconvenient to go to these things for you and your peers, but this is very useful information for anyone in the healthcare space and supporting the technology there to be aware of. And I think we have, Zoho has a lot of tools that can help with the analytics and the CRM platform side. And when I was thinking about what Bill and John were saying, you need to be able to track what vaccination someone has, both within your working space and within your patient space. You need to be able to track that. You need to have an inventory management system that when you have something thawing out, you know how much time you have before you can transport it, and you can list those things. You're not just in healthcare anymore. You're in operations, you're in shipment, you're in customer tracking, you're in employee tracking. The world of healthcare has fundamentally changed. The world has fundamentally changed, period. But on the front line of this, you're in the technology space, your considerations go from optimization and efficiency to survival and protection of the people that are serving and protecting those. And we're here to help. And I think everybody from any technology space, whether it's on the pharmaceutical side or on the technology side, we're also here to help. Think about, not just provide those tools, but to help think about and connect people together to solve these things. I think these are big deals to do, and no one should have to do this by themselves. And we got to support each other through this process. And there's a lot of space for us to improve. So I don't see any questions popping up. I'll leave it open for Bill and John. Perhaps you want to have some closing thoughts as we round out this hour about what advice would you give to technologists in the healthcare space, especially with 2021. And maybe
my advice would be look for a career in home care. We have a place for you.
Yes, we need more people in home care. John is hiring. Bill has a lot of contacts. If you want a exciting job that takes care of people and makes a big difference, I would say that's a good place to go. There's a lot of demand, and there's definitely a shortage of supply. I know I'm Filipino, so I know my people are all in. So, and I will show a picture of my bike for the folks' benefit. Let me know when you see it.
So Ed, while you're showing your infamous bike there, I think what I would caution/warn technologists about is that something that we started with. It is about the people. It's about the employees. It's about the clients. Anything that you're doing right now should be really focused on servicing them. You can put in the best technology in the world, but if it's not serving their needs or if it's not easy to use, I think Bill said that maybe he's not the most technology savvy person in the world there, but I would counter that argument and say that the technology has failed if the normal person out there can't leverage technology in a way that's meaningful for them. So I think that's maybe the biggest message I would have is you don't always have to lead with technology. Sometimes it's listen to the service provider, listen to the client, and then solve the solution with process, solve the solution with technology, and go from there. And I'll just end by thanking all of the healthcare workers, Recover Health, of course, but any and all healthcare workers out there that are on the front lines, that are serving our communities in ways that they probably never expected to happen in their lifetime. Thank you for everything you're doing. We really appreciate it.
Thank you. We had one question that went out to Bill. What are new technologies that communicate to seniors in care center? What have you seen? There's no more isolated place than to be a senior in a care center because they don't want anyone to come in. They're not used to, have virtual visitors. It's a little bit of a technology gap. What have been some of the ways that seniors or technologies have been using to communicate with the outside?
As rudimentary as Skype and FaceTime. One of the waivers that the Medicare Medicaid program allowed was for telehealth using non-HIPAA, compliant technologies of that nature. So I think that's really simplified it for a lot of people to be able to do that.
A compliant question. How
serious compliance question in the future because they're not going to permanently waive HIPAA requirements. So the technology is going to have to advance so that the person can pick up their own smartphone and contact their nurse, or vice versa, the nurse contact them. It has absolutely proven important that it be more than just an audio connection. Although the aspect of broadband has created a need for it to be audio only in some places. And that's a big policy issue in Washington now. How do we expand broadband access so that we could take advantage of these advances that have occurred in telehealth type technologies?
Now it's not just market demand; it is essential. So I think that's
there was a lot of question about comfort zone, and the equipment changes in it have made comfort much greater. At one point, nurses were going into homes with a laptop. The 17-inch laptop was a barrier, and now they're going in with smartphones, and you can see each other's eyes. You can't see their smiles because they're wearing a mask.
I think if they're smiling well, it shows up in the eyes. You can tell.
Just so that everybody else can probably see Ed. When he smiles, his eyes show it. That's for sure.
Here. So if my eyes are not affected, then I'm fake smiling. So you can see it in my eyes. And I'm really smiling. It's been a real pleasure to speak with you. It was a real learning experience for me, just getting to know you guys and my sincerest appreciation, not just from a Thanksgiving standpoint, but for leading through this environment, for helping guide leaders through this environment, and for demonstrating a way to adapt and change, and for giving hope and for care to the many people within your organization and the people that your organizations serve. So I really appreciate the time. I hope that the audience appreciated it too. And I would set another question of how you're feeling, and hopefully everybody's still feeling on the 5-star rating. How you guys feeling? 5 stars? Great. 5 stars. It's fantastic, again, to have you guys both. I thank you guys as well as the audience for participating, and please share this with folks that are in this space and have questions about technology, and reach out to us if there's any questions that you might have as well. Thank you, Bill. Thank you, John. We'll be talking to you soon.
Take care now.
Bye.